and they were really uh, they were really uh, not thinking that much as they are spending time with the nature and enjoying themselves in the nature too. So, for those people who just joined, let me rephrase what I'm trying to do here. I think we need inner resilience, but most of the people display that they don't have the energy or strength to deal with their life's problems, and they get upset very easily. They react easily. They have no patience to listen, and they have a lot of these things are happening because we don't do self care. When it comes to self care, I would say a lot of ancient systems of naturally moving and thinking less and enjoying ourselves, that was much more effective, right? I thought combination of ancient wisdom and the modern medicine is the way to build up our resilience. If you look at the people who have resilience, what do? They are embracing change. They are not afraid, they don't fight it, and they don't say, I'm not going to adopt this new technology. I saw that with the EMR adaptation, electronic medical record adaptation in the hospital. And many people don't want to change it to computerized documentation, right? And a lot of these people who um, really don't know how to build inner resilience, I used to tell them, embrace change. That's number one. Number two is, whatever negative thoughts you have, counter them. Don't yield to them. And also finding a sense of purpose, right? And building your collections around. Okay. And then learning from your experiences, not living in the past, but learning from them. And then have a confidence in your abilities, build them and do them, and then gain confidence, right? And then develop these problem solving skills. Don't run away from the problem, but look for the solutions and learn them, and then share with other people. Okay. um, Generally setting realistic goals and being proactive, taking care of yourself, being optimistic and practicing gratitude, all these are signs of people who have uh, inner resilience. So you can build strategies to build resilience based on this pattern. Okay. Now, what happens with the inner resilience and development, because with scientific medical things that we do, and also adapting some of the healthy practices from the ancient wisdom, that results in better chronic disease management than what we are doing now. Okay, that is my point. You see, I want to understand why we're not incorporating them, and then important. See, this approach of inner resilience through a fusion of ancient wisdom and scientific medicine, I believe, is both innovative and also holistic, right? So, some ways how to do it is meditation, mindfulness. You know, if you can incorporate this mindfulness meditation practices, basically to cultivate present moment awareness and inner peace, right? This can include maybe um, doing some few frequent deep breaths, 7-4-8 technique that I teach, or encourage regular meditation sessions are also there for us. Take part in them. That is there. Not me, because everybody has them. Even in the Mumbai has them. So do them. Okay. And also, whenever you know some Ayurvedic principles for balancing mind, body, and spirit, look at them, study them, and approach them. Many scientific validation research is happening. Go and look at them and help yourself. You know, one thing you want to do every day is self-reflection. In the morning, and you can do journalism, or you can do self-compassion activities, or just sit down and reflect on what happened through the day. And then comprehensive self-care. That is the word I always use, CSC. comprehensive self-care. Okay, um, see, physical activity is important, and then you promote the lifestyle where you sleep properly, you eat properly, you hydrate properly. That is the self-care. And then give and gain support from the community. Lots of times you may not get all the support that you need from the community. Then start to give and create your own supportive groups, and let people come in there and help yourself. And then most important is connect with the nature. Go take a walk, be with the nature. Just watch it from inside the house if it is cold like us here. So many ways you can connect with the nature. Okay, how does this really result in chronic disease management? Is okay when you really develop this mental resilience, you will be mindful, and you'll be doing a lot of things that you want to do rather than imposed on you. And you can also develop emotional intelligence when you really help people to uh, come to you for understanding, and thereby you can provide service. You can also gain a lot of emotional resilience too. Of course, treatment network. So all this results in a holistic approach to healthcare. It addresses physical and also mental well-being and also emotional balance, right? So what happens is when we combine these things, what I noticed there's an enhanced treatment efficacy because people understand what's happening, why they are taking all that, and we can provide a holistic patient care, combining modern treatments with simple things like, you know, yogasanas, breathing, or calming your mind, and all that helps mental health also, and reduces stress reduction. Okay, so I really combine these. By whenever I suggest anything for people, I will have the treatments, but also some integrated practice that can be like a therapeutic lifestyle change that will help them in the long run. Okay, so uh, what is this integrative uh, patient care is you combine a lot of things, and that makes it a holistic patient care. You attend to the physical health, emotional well-being, mental state, spiritual needs, and also environmental factors. You see, so the key factors here is addressing the root causes, and then making the modifications in the lifestyle, and then adding complementary therapies. Is basically a patient-centered approach, you know, to the individual needs, and also focuses on prevention. Really emphasizes the disease prevention and health promotion, not just symptom management. Okay, so all these things promote efficient, enhanced treatment, right? Enhance the efficiency of the treatments. And also, it does improve the quality of life so people can do more stuff and enjoy more. And also, in the long run, you can reduce your healthcare costs. Okay, that's why I'm developing these workshops where people can come and really address some of the problems that they have practical. So I had a session yesterday, which my friends um, Peter and Janet and Elizabeth and Rohini and Dharni, they attended, and we selected, I think, 3 or 4 topics, and then in the afternoon session, I was able to show them practical things they could do. They could adapt and take it home and implement right away. So those kind of workshops I found, which was satisfying for me because I was able to ask them what is that they would like to. They wanted mobility, so I showed them how I am mobile during the day. Even now, when I'm talking to you, I could stand, I could move about, or I could really sit and do it, and later on get up a little bit later. So incorporating functional movement into the daily routine is what I was advocating. I was showing the examples. So I was so pleased with what I was able to do with the people that were there, and I wanted to expand this. So I'm going to do it every Saturday as a routine for people to come in. And in the morning, we discuss and understand and educate ourselves. And then we pick up some things that are really worrying them. Like it could be a physical complaint, it could be a mental complaint, or it could be something related to their emotional being, or it could be something like spirituality that they were seeking. There were questions like that: mobility, energy management, and muscle tone management, and also spiritual quest. I covered all this four, and the people who attended also kindly told me that that was very useful for them. And so I'm extending that every week. I'm going to do it. Maybe there could be club members and attend them, all the four, or any one, two of them, as was their choice. So this inner resilience is lacking, and you could see the weakness. People are seeking group support mainly because they can find it within themselves lots of times. Maybe some people do that and also want to be part of the community, just to service and just to interact with them, just to get that kind of just being with other people. But it's a lot of people look for strength from the group. you know that's one of the weaknesses also, because many people want to play one group against the other group, and in that process they do have a lot of negativity in their lives. So we don't want negativity, right? Like I enumerated those 9 things you can do. Second thing is, really don't encourage negative thinking in any form, right? So whatever you find, inner strength is different from you are getting encouragement, you're getting confidence, you're getting validation from other people. That may not be there, but there are ways to really reflect on your problems and really calm down and get answers from within is a very good way. That's where the better your self-care, the better your resilience too. So if I can give a medication, then I'm giving an external help, which is needed sometimes. Okay, but a lot of chronic diseases are because we don't really pay attention to the disease process, which is cooking under the hood, right? So you want to be more aware of it and bring in some intelligence about managing those evolving chronic diseases by using not only the modern medicine but also ancient wisdom. That's what I'm practicing, and I'm trying to help my patients do that too. Okay. So this topic is huge. So many problems are there, but I'm just describing the approach here. Modern doctors themselves are not doing the chronic disease management. By if they have something, they are not able to reverse them, right? They are not able to reduce the outcomes of this chronic diseases. That is one thing that's happening as a whole throughout the country and also throughout the world. So we are spending so much money, really it's not helping anybody. The money that should have been going to, mainly the education and research, we are kind of wasting away, because if you prevent and if you allow yourself to be healthy, you can save money on the medications, tests, and preventive work tests. They're okay, but then a lot of defensive medicine that is practiced by many physicians because they are afraid of getting sued, which is a reality. If you are really in charge of your wellness, and that's where I say, be proactive about your wellness. Don't give it to somebody else. Get educated. Go and find out, question, doubt, and research and find out what are the systems there, what are they doing, how your body works, how your mind works, how your energy works, all those questions. Okay, yes, that is what I'm saying. Proactive wellness, being proactive about our wellness. First of all, finding out what's wrong with us, assessment, and then what are the ways I can fix this? What are the ways I can eliminate this? What are the ways I can prevent completely in my children and other people if it is related to lifestyle and if it's related to the culture and all that? Okay, so there is so much wisdom about being holistically well for a long time in yoga system that I know that I will try, but there are Chinese systems, there are Japanese systems, so many good things are there. We can study them. We can study all of them. At least stick with one system that you can implement, whichever way you can do, and then bring those changes into your daily life. Okay. So I'm discussing here approach I am taking, but you can come and ask me about any questions related to your holistic health journey. It could be a physical thing, like they asked about mobility, which is very, very important. Functional mobility is very functional. Fitness is a program that I do, where if a doctor or nurse talking to me, then I'll ask the doctor or nurse show me their routine, what they do physically. Then I may improve ergonomically furniture, the type of route he takes for the work, or prioritization of taking breaks and then doing some physical stretches or breathing, whatever that renews you. After a few days work, you do it, that's no big deal. But few hours and then you do it, you will be reducing what we call tamas energy, which is stagnant. The more you become stagnant, the more you are flowing, the more you are developing this bad energy. Okay, lazy energy. We need that when we are retiring to sleep. Okay, you have to cut down everything, body rest and mind rest and all that. Then you need the tamas. But you don't need it when you need to be active and working. Then you need rajasic. That means energy producing, energy preserving ways to do your work. You could be in the flow of working where it's almost effortlessness, and also you are enjoying the activity. Then you are in a flow. But if you are in a flow, you will do much more than you are interrupted so many times. That's what's happening in the modern life, right? So hopefully what I said makes sense to you, and you can come and ask me questions here, or you can come to my workshop and ask me questions there too. Either way is fine. Okay. I was doing a comprehensive yoga routine today. Then I thought I wish I had allowed everybody to see this. It took like a hour and 45 minutes, right? I started with a yoga prayer, which is like asking the divine power, like, asking, give us energy, not only me, everybody else who is doing this with me, to be awake and to be alert and then to be doing this, and then not competing with each other but learning on the way, something like that. The very good poems are there. I use one poem at a time. Then you kind of do the preliminary breathing, preliminary stretches, and then I endorse into almost 25 different asanas, one after one. And before that, I really did the sun salutations for 3 times or so. And then there's 25 asanas, and then 10 different pranayama practices, that they were done. And then I did what is called shavasana, which is complete relaxation after workout, right? Which is a very important thing in yoga. And then I kind of did what is called Shambhavi Mudra, and then completely being in silent. So all this took like 1 hour and 45 minutes. That I do on the weekend as a comprehensive yoga program. Okay, and that keeps me really up and high in the energy, and then I can do a lot of things. Okay, and then I kind of took a leisurely talk with the people I wanted to talk, and then I came here just to talk with you people. So getting up early in the morning really helps me to do a variety of things even before 9 o'clock. Remember that saying is, army does all that we do in one day before 9 o'clock. That is so true. Ancients have woken up in what's called Brahma Muhurta. That is between 3:30 to 5:30. Actually, it is 45 minutes before sunrise. It varies, but generally 3:30 to 4:30 or 5:30, they call that Brahma Muhurta, and they encourage us to do this because these are mind-body practices where you are doing something with the body, but your mind is right there. It helps because the rest of the world is sleeping. Calmness, quiet, there is no even electromagnetic energy, right? Everybody is sleeping and all. So it promotes better focus, better concentration when you sit down in meditation and all that. But that is initial. But later on, even if the world is making a lot of noise, it doesn't matter. You can withdraw into your own meditative corner and stay there completely, right? So this approach I'm taking to the chronic disease is not new. I talked about it so many times. I'm just bringing it to your attention and see whether you guys have any suggestions or want to ask me questions or doubts, anything, you're free to come up and ask me about them. Okay. Many people are really learning a little bit, but then really not applying it. That's important too. You apply whatever you learn, and don't give it up if you cannot apply completely. Like I say, come on, be in the present, right? You may not be able to do it all the time, but you will slip and come back. But be aware of that you slipped out of it and come back. All that you have to do is, what is that I'm doing? Am I in the present with this? Right? So then you'll come back to the present moment and just focus better on what you're doing. Okay? What you're doing, you are not allowing the mind to vagabond and go wherever it wants to go. But you are bringing the attention deliberately, intentionally to what you're doing. Okay? That way, the springing of the thoughts coming into you, they kind of come and go. That is what is going to happen as long as you try to practice this. Okay? And then you will be doing everything focused, really concentrated, really attentive, and that induces quality into your work. And then you'll come out of it. Don't have mental explanation for everything, but mental attention for everything. Don't think about it, talk about it on everything. You can do that separately, or you can think a little bit, but then learn the ability of switching from the thinking mode to attentive mode. When you become attentive to what is happening with you, you are automatically in the present, right? So this, like this, there are so many, I would say, habits that may not be working for us, we have accumulated. So we created an elephant of these habits, and we are at the mercy of them. Right? So there is energy concern, there is a psychological motivation concern. There are so many things to actively play, especially if you have too many things you are doing in your life. Okay? Plan too many things, take up challenges, projects, but when you are doing them, that is the test. Am I in the present moment awareness or not? Okay, use visual aids like that. Okay, so there are so many small things that are happening without our knowledge, and they become our tendencies, and the tendencies dictate behavior, and the behavior consolidates into your own nature-like. This is why I do it, and then you do them quite well. Okay. Um, so, anybody has any questions or comments, or you want to come and comment about it? Please be my guest. Janet is there. She has been improving quite a bit. I'm very proud of her. That is one age group I really want to help, because a lot of misinformation, even with the family members and uh, people who are really old and getting feeble, doesn't mean that they have to continue to go feeble and then not function well. Okay, but you have to treat them gingerly. Okay, like a you handle with care. So you don't want to impose too much on them, but a little bit at a time and increasing slowly is important. For that you need to care about the person. You need to really allow them to get into what is comfortable, what they can do, and also you encourage them, but don't force them, don't push them, basically. So that kind of thing, if you approach, then you can make them get up out of the chair, walk a little bit, and improve that walking ability as they train every day. Okay, so that's an example, okay, of really putting the chronic. On the other hand, if you really tell them you are old, you cannot really move, stay there, and you are encouraging the chronic diseases to get worse, right? So it's not enough just to take the medications and doing half an hour work, and then the rest of the time you're sitting in the chair or bed. That's a sure way to lose the muscle tone, and also your joints freeze, so you may not be walking very well. I mean, each doctor is not going to he will not have the time also to focus on all these things. It is you take the responsibility proactively to be well. Means I need to make my own effort, or my help, or my relatives, or whoever taking care of me. That is the one. Caretakers, they have tremendous stress too. But the more you are, you know, aware of your condition, aware of what are the solutions, and you can do them slowly, do at your own pace, but do them. That is the comprehensive self-care that you can learn, and you take responsibility for it by yourself. What am I eating? Where is the food coming from? How are they preparing? How am I consuming it? All that. Am I exercising enough? Is what I'm doing is optimal? Am I walking for a half an hour, 1 hour in the morning, and rest of the time I'm sitting there? Counterproductive. Move simply, and then if you need extra, workout, do that. Okay, but if you just move for half an hour a day on the treadmill, and the rest of the day, it's better that you're doing at least half an hour on the treadmill. But then if you think that's enough and I can go and indulge myself and put myself in the sofas and really don't move the body at all in the way I should be moving, then you're going to pay for it by really chronic diseases, especially they worsen. And also the society here is more like treating young people, active people well, neglecting the old people. And then the nursing homes also, because they don't have much money coming, they just do with one or two therapists on a regular routine. But that is way, way insufficient in terms of movement, right? And many people don't sleep well because they are working late, or they're watching TV, and also they may really dreaming a lot, because which is not conducive to restoring your mind and the body to optimal health. So learn about what is a good sleep, how to acquire it, how to sleep it, how to practice it on a daily basis. And the most important nowadays is the how do you manage your mind movement? right? If the mind is moving all the time, don't think that is like you are very clever or more intelligent people. Okay, it's kind of that kind of unfocused, uh, no meaningful, purposeful thinking is actually the mechanical thinking that goes on and goes on, makes your mind less intelligent, basically. So that's what you want to understand. Is a big topic. Ancient wisdom has is like a dean, whereas the modern types of mind understanding is at the kindergarten level. Okay, I have no hesitation to say that, because neurologically they were much more balanced, much more focused, and always really enjoyed inner bliss and peace and happiness. Okay, we, as a culture, as a civilization, as a modern era, don't have that. That is something I am blessed to touch, and I'm blessed to share with other people. Okay, so that's about it. And I've been here for a while now, at least half an hour, right? So anybody is listening there or want to make a comment, come up and tell me what is that you want to ask me about in this regard. What is your understanding of chronic disease management? How are you doing them if you have them? Do have you given up on them, or do you have some active lifestyle changes that you are employing and you are getting benefited? Otherwise, your capacity to enjoy, your capacity to do stuff you want to do, your capacity to enjoy your relationship, they all go down when you get up, invalid, like, and people can make with their not understanding what is what. Because I see my own distant camp family members in India, they are making my sister sit down all the time without realizing that's not good for her. So I kind of talked to her, made her get up and then take responsibility for her own wellness in that way. And then she religiously does yoga in the morning and walks throughout the day, and only to the capacity that she has. She's 83, so she does something. But then she is able to enjoy whatever she is doing after this regular exercise that she is doing. When she is not able to get up and do it, I kind of gave her this strings, and then with the string she was able to do sitting down in the chair. So we have a variety of things you can do. Okay. So hopefully all that makes sense to you, and don't be intimidated by this, but just take it gently, and then ask yourself, am I doing the right thing? Can I do more? Where can I get the information? And then go from there. Okay. So like I said, I liked the workshop. Well, I see the potential for it to do some good for my friends and patients who ever come to participate in them, and then take home some things that they can employ. They can always send me DMs through the week of what exactly they want to talk about, what exactly they want to investigate about, what is that I can add to that, whatever management they have put into. Like, for example, diabetes, very common, right? It has become like a pandemic all over the world. Even the India, where I come from, that is the capital of diabetes in the world, I believe, because they eat rice all the time, and that's not good at all for them. They burn the pancreas out very quickly, and then they are suffering from the diabetes. My niece, she's around 60 years now. Her husband is really sick chronically, So she is having the burden of caregiver and also breadwinner, right? So enormous stress for that, and her blood sugars are hitting the roof, you know. So I have to talk to her and I have to advise her about stress and the role of blood sugar, and also change the diet radically. You know, there's too much for her, right? Too much going on. Especially the caregiver stress is really real, enormous too. So when you have all that going on, even if you take insulin, the blood sugar is not too controlled. But take the insulin and blood sugar pills as needed, but also employ these lifestyle changes. That will be really helpful to you. Okay. And we attempted to talk about one particular disease, not about educating on the disease completely. You can do it in your time. But what you want to bring it, what is it that is happening in your life, and then you are not able to control blood sugar like that. You know, when she brought me that, then I kind of examined not only her personal health habits, but also how her interaction with her husband, other community members, how she is spending some time about educating herself, researching on the topics, and then acting intelligently about controlling the management of the diabetes. That is what I want to do with many people, to show them the lifestyle changes, show them the intricacies of those, and how they can implement them. Okay? Okay, then. Hopefully, what I made makes sense to you. Be proactive about your awareness. Take interest in your comprehensive self care, and really understand chronic disease progression, and then act accordingly with meaningful lifestyle changes that you can do. And I'm going to do the workshop almost every Saturday. Even few people come, I don't mind, you know, but I want to even one person also. But I continue to do them, and asking people to participate, and then give me a chance to help them help themselves. Okay. Thank you, and I'll see you later. Bye bye.